You are all most welcome. We are going to give people 2 more minutes and then we'll begin.
Okay, that's good.
Just housekeeping, if you are not speaking, please mute yourself. Okay. Good morning, good afternoon, or good evening, everyone, depending on where you are. You are all most welcome to this webinar. Having CUGH and AFREhealth together, this webinar is important to us. It shows the power of collaboration and partnership, and we've come a long way. Our collaboration has really grown, and CUGH and AFREhealth are working together as true partners. So you are very, very welcome. Keith, Martin, and Andrew Dickens, thank you so much for joining us today, and all other members from CUGH. I also welcome all members of AFREhealth, and if we have guests, you are all very, very welcome. Yeah, it's about networking. Networking is important for us at both organizations because it brings us together. It is about interaction, it's about engaging, and one of the ways we can do this is through the CUGH Capacity Strengthening Platform. And this is a great platform that has been developed over time, and we really appreciate CUGH for coming up with this platform, and Andrew for your hard work and persistence. You are very much appreciated, and we would like all of us to really engage with it and use it. That's why we've put this webinar together. And for us to be able to have an impact in our capacity building, we need these networks. And there are different ways of networking, and one of the ways is to go through this platform. So please, even before it is presented, for those that are hearing about it for the very first time, please use it. And those who have used it before, continue using it, and we make sure that it does what it is supposed to do for us. So I would like to welcome Dr. Keith Martin, the Executive Director of CUGH, to give a few remarks, and then we'll continue with the program. You are welcome, Keith.
Thank you very much, Dr. Kajuli Malwadi, and a big welcome to everybody here. It's very much an honor for me to be here with colleagues, Dr. Andrew Dykins. And I also noticed that Mr. Samuel Omedoyan is here. And for those who don't know, Samuel co-chairs our student group, which is a group of growing network of global health professionals around the world. So if you have any questions or want to engage Samuel, and if you're a student want to be part of this, please contact him in the chat, and he would love to connect with you. So welcome everybody to this webinar, as Dr. Kajuli Malwadi said in her opening comments. You know, some years ago, AFREhealth and CUGH, we put our heads together and we said, how can we deal with the ever-growing, worsening, and very worrisome problem of a lack of trained human resources, particularly in low-resource settings? And so what we did is we co-created with Dr. Dykins, Dr. Kajuli Malwadi, and other leaders within AFREhealth and CUGH, we created the platform that you're going to hear about today. So we know that if you're going to strengthen and build capacity, you need a number of things, right? You need to train people, you need to have infrastructure, money, and you need to have political commitment. That capacity, though, deals not only within academia, but also within government and the public service. So what this platform that you're going to hear about is a tool. It's a tool that we need you to use. And we provided it, co-created it in a manner that we hope is useful to you. So our plea from CUGH and AFREhealth, I think, is to say, please look at it, please share it, please use it, because it actually is a tool that you can use to not only strengthen your own training programs, which is what it was used for, but also to try to forge relationships between academic institutions within your own country, with others outside in the region, but also finally, and really importantly, that academic institutions forge relationships with government ministries. Because there's a whole lot of assets, right, in academia in terms of training, but also research and research capacity. Governments don't have that in many cases, and I'm a former public servant. I can share that with you. So we need to bridge that divide. And this platform is a way to do it. And with you engaging your governments persistently, it's an opportunity to create a win-win situation to strengthen their capacity to deliver the public programs that people want. And finally, behind Dr. Kajuli Malawadi, you see a nice big sign for the AFREhealth meeting in Nairobi. Please go to that. And then please also come to our meeting at CUGH in Atlanta if you can, which is going to be in February 20th to the 23rd. You're all very welcome. And that site, cugh2025.org, will be available and open by the end of the year. But we hope to see you in Nairobi as well as Atlanta. Thanks, Elsie. Over to you. And thank you again for this opportunity.
Thank you very much, Dr. Martin, for being here. And thank you for those comments. And thank you for promoting our symposium. That's very nice of you. And we are looking forward to seeing you there. So members, we'll continue with our program. And next we'll have our Executive Director, Georgina Eboa, to speak to us. Georgina, over to you, please.
Good day to everyone. So for good day cuts across. So whether it's morning, afternoon, evening, wherever you are, I must say that we are very happy to have this webinar. We started the discussions last year. We had a webinar at a symposium. We had a session in March in CUGH. We continued, and today we are here continuing with disseminating this good news to our constituents. And we are very happy that we're getting people from all over representing various professions also on this program. We hope that you will all enjoy and you also join us as we propagate this good news throughout our various networks. So because I'll be responding to some other issues, I want to just end here. You will enjoy this session. Back to you, Elsie.
Thank you very much, Georgina. Yes, we'll continue with the hearing about this platform. And I would like to introduce Dr. Andrew Dykens, and he's from the University of Illinois, Chicago, and many of you might have met him last year in Mozambique. I hope, Andrew, you are going to be there in Nairobi as well. So please tell us about the platform. Over to you, Andrew.
Thank you so much. It's an absolute honor to be with you today. I really appreciate the invitation and the opportunity. It's been an extraordinary journey collaborating with AFREhealth over the past several years. I'm in the process here of sharing my screen so I can introduce to the group. the capacity strengthening platform. Please let me know if you're able to see my screen.
Yes, we are able to see it. Thank you.
Wonderful. Thank you so much. All right. So I will also take just a second here to set my timer because sometimes I wax poetic and talk too long. So I'm going to try and limit myself. But I wanted to just say thank you so much to AFREhealth for supporting this work and working very closely with CUGH over the past many years. This has been an extraordinary journey. Obviously, Dr. CUGH Mawadi has been working with us very closely. We've been working together on this platform for many years, and this has been really an extraordinary initiative, and it's really a joy to see this come to life. So what we're going to be sharing with you today is this platform. Think of this as the opportunity to expand your network, as Elsie had mentioned, in real time, all the time. Just like when we're at conferences, we really find the joy in connecting with others, seeing where they're at, what they're up to, what they're interested in, and making those connections to be able to identify new ways of collaborating and sharing resources and addressing this critical workforce issue globally. This platform is meant to help facilitate this type of opportunity all the time. It's there now where we can connect in real time and engage with others. The primary purpose of this is to connect individuals and institutions to share training resources to build training capacity. There are a lot of creative uses for this platform in doing so. So I want to just give a brief shout out to many of the team members over the years that have contributed to this incredible effort. And I wanted to also acknowledge the funders that have contributed to this, beginning with a Tom Hall Education grant in 2017, and then Fogarty International Center at the National Institutes of Health in 2022. So we're really grateful for that support, and looking forward to moving this platform forward. So as has been mentioned, healthcare workforce is absolutely essential in meeting our goals of access to high quality healthcare services at the primary, secondary, and tertiary levels in order to achieve universal health coverage and attain those sustainable development goals. This is absolutely essential. The platform was built with several principles in mind. And this is really, really one of the key aspects of this, because it really is meant to empower institutions and individuals in need of capacity so that the conversation is not necessarily driven by funders or mechanisms or other organizations or institutions that have their own priorities. And so it's an opportunity for institutions and individuals to engage with the platform, identify their own priorities, and then connect with others in a way that makes sense. So please keep that in mind. We really are encouraging the opportunity for quote unquote South-to-South collaborations. This really makes that more feasible, where that can grow organically, and really a significant focus on equitable matchmaking to make sure that there's reciprocity and strong contextual understandings, longitudinal partnerships, and then these, as I mentioned, local priorities that drive the external focus and not vice versa. So really focusing on equity, reciprocity, bidirectionality, social justice, and then humility as we engage and learn from each other through this really exciting platform. So I want to challenge you all today as you're learning about how to use this platform, and then hearing the perspectives and stories from others in AFREhealth and those who are engaged with the platform, to really just go ahead and dig in and engage with this. I'm going to teach you how very quickly here in the last few minutes of my presentation. Go ahead and pull out your smartphone. You're going to see some QR. I'm getting a notification that my internet is unstable. I'm just going to make sure here that everybody's hearing me okay. You're hearing me okay?
Yes, we are hearing you very well.
Thank you so much. I'm going to continue. Get out your smartphones and scan those QR codes and follow along with me. I'm going to primarily teach you two major aspects of this platform today that I want you to focus on. Number one is registration. It's very straightforward, And the second is creation of a post. Now, this is essential. Registration is good. It gets you on the platform, but the posting itself is what helps you connect with others in ways that are of most importance to you and helps others to find you and connect with you most easily. So please follow along. Let's dig in. All right. So what is this capacity strengthening platform? Essentially, this is an online platform that facilitates the opportunity to engage with others through registration, creating postings, as I've mentioned, the opportunity for search for others, connect, and then strengthening capacity together. Please note that there are 3 areas in each of these sections where we have the opportunity to post training needs and expertise, established trainings, and then mentoring opportunities. I'm going to define these very quickly. Training needs and expertise. This is what you might think of as partnerships to develop a capacity strengthening program to train a cadre of healthcare workers in the field or in pre-service training, those that need some additional training support, developing a collaborative opportunity with another institution or individual to develop that training. This has not already been developed, but it's something that's needed. So this is where you're looking for partners. The second one is an established training. If you are offering a training where you are offering enrollment opportunities for individuals to just participate in the training that is already established, you can register and post this training here and others can find you and connect with your training. So this is a really unique opportunity to advertise and disseminate those training opportunities. And then mentorship. So as a mentor or a potential mentee, you can post to advertise to others that you're available and want to learn from others on an individual basis in terms of clinical research, et cetera. Lots of opportunities. And so these are the 3 main areas that this site focuses on. And you are welcome to create postings across all of these and multiple across all of these if you would like to find ways of connecting with others. All right, so let's dig in. All right, so this is basically where you're going to sign up for the account, and then it's a very brief, quick survey where you're going to fill in just some of the essential information. Once you're registered on the site, you will be provided with a profile, and you are given the opportunity to dress that up a little bit. So add in a photo, and you can provide a little bit of additional information to tell others about yourself. If you have some additional things to share and just to make others aware. So editing that profile in that way. Here are some examples. You're going to hear from Josephine in just a little bit of some other profiles that exist, and you can connect with these individuals and many others. So let's learn quickly then how to create a posting after you've registered for the site. And again, this is a really essential piece of the puzzle here. On the dashboard, you'll see a link that says create posting. It's as simple as that. Click on that and it takes you to this page here where you can create a posting title. This is where you'll put in some sort of informative title that explains exactly what you're looking for, connecting for potential mentorship in cervical cancer training, or something along those lines. Be very clear, because this is where people can identify initially how to connect with you and what you're interested in connecting on. You're also going to be able to answer some additional questions. You're going to identify this as a general posting or something that's very specific to implementation science, which is one of the focuses of this platform. Then you have the opportunity to select training program, mentoring relationship, or partnership, which is what I have just explained to you, the difference between those. You can also state whether or not you're someone that has this training expertise available, or you're seeking this training expertise and there might be a gap at your institution. Then you can provide additional context, more detailed information if you want. None of this is required. But you're welcome to provide more information about the audience. Is this something in the public health sector, medical education, nursing, et cetera? And you can even specify more specifically if it's in public health, perhaps epidemiology. You do not have to put in this information, but you're welcome to context, what language, where, how long, etc. Technical information, does this apply to a particular disease focus? If you want to identify something, this is focused on neoplasms or cancer, you can select that just to give other people the opportunity to find your posting more easily. And then you can specify with some open narrative, responding to some of these questions, describing the opportunity to partner and additional information, and then even a link if you want to do those things. You can then submit this, and then it goes live automatically. You have the opportunity to edit that, and I'll show you how in just a second. Then you have the opportunity to search. So you can search across all postings or just specific to implementation science if you would like. And this is the page that you'll find. And the most recent postings will be listed here. And then you have the opportunity on the left-hand panel to focus in on your search through a keyword search or through filters. And this helps you to identify those things that you might connect with more easily without having to just scan through all of the posts that are available. If you find one that's interesting, then you can just click on it, and it'll take you directly to that post. So here is an open word search for cervical cancer, and it brings up automatically those. If you're seeking for implementation science training programs, it will bring up those. And this is what a post looks like. After you've clicked on this, there's the title, well defined at the top, and the type of posting is also listed there. Who has posted this and the descriptors, as well as the contextual piece off to the right. At the bottom is the individual, and you're welcome to connect with them by clicking on this connection button. And then it identifies when this was published and when it will expire. All posts are live for 1 year from posting, and then they're automatically archived unless they are updated. This keeps the site up to date at all times. Off to the right, there are links to social media. If you find a post that you think others might be interested in, we highly encourage you to go ahead and click on these, and it sends it out automatically to your social media platform where you can connect with others, share this, and that will help us to bring others into this site and connect with that particular post. You can send an email to individuals if you think they might be interested in that. This helps to spread the opportunity for connecting in this platform, and keeps people engaged about what types of opportunities for connecting and collaborating and building partnership are. So connecting with individuals, as I mentioned, is a key component of this platform. There's a social media component where you can engage directly with those individuals. You can connect, and then you will find that the request was sent. They will reply to you, and then you will be able to connect directly with them on their own site. You can have conversations with them on their timeline by writing something to them here. And then you can engage in a conversation to determine if you would like to develop a collaboration. You can save postings by clicking on the heart that saves them into this particular area so that you can come back to them if you're interested in that particular posting, that connection, and you want to explore that further. So here's what a save postings area might look like. You can take those off at any time by unclicking the heart. Now, connecting with others, you can find the individuals and share on social media and find the connections that you've already made and have conversations with them. You can also direct communications to the site at large or just to that individual by typing into these areas. This all enables us to strengthen capacity together by working collaboratively and sharing and connecting, engaging often with your saved your saved connections. And then in the messages area, you have the opportunity for those that you have previously connected with. You can send them direct messages. And in the message area, please note that when you send a message directly to someone, this actually engages back to their email. So it also communicates with them on the platform as well as through their email, but it keeps the email address hidden. So there are privacy features in place so that your personal information is not shared with anyone else on the site until you share it directly yourself. but they can communicate with you through your email without that being released. And that's a really valuable opportunity for engaging with others, carrying on this conversation, developing these relationships until you feel comfortable that you really do want to connect and develop a collaboration together. We encourage you to register your matches on the site by creating a new match. Classify the type of match that you have created, and this helps us determine what type of impact this site is having. You can give updates, annual updates on this, and in the matches area, you can see these updates. You can provide citations for articles and documents, other reference documents that you have developed together through your collaboration, and you can note the number of healthcare workers that you have trained through this collaboration on an annual basis by registering those, as well as a contact person for those who are interested to learn more about the partnership and perhaps even collaborate and replicate the work that you have successfully achieved and apply it to new contexts. Here's an example post for someone seeking partnership. Another example post would encourage you to get on and take a look around those seeking mentorship opportunities. Again, another mentor opportunity post, just to give you some examples of what these look like. Training programs that currently exist. Someone wants to learn, they can apply, find information on the relevant websites. These are up and available to be identified. And then an example match where work has been done and documents are provided for us. So please contact us if you have any questions. You can send us information through this online web form. Please go ahead and scan the QR code, connect with the platform. Let us know if you have any questions. Thank you so much for the opportunity to share this. And I do encourage all of you to share this widely, bring in as many people as possible to this platform to make it as impactful as possible. I look very much forward to seeing you in person in Nairobi. Thank you so much.
Thank you very much, Andrew. That was quick and precise and very clear. Thank you for sharing with us. And members, this is very easy. So please, we are leaving that on for a few minutes. Leave it on for a few minutes until Emilia is coming on, and so that they can scan and join. So thank you. Yeah, we appreciate all the work that you've put into this, and some people have used it and they are going to tell us about how useful it has been to them. So that is coming later on. If you have questions, please keep them, or comments. We shall have time for Q&A at the end, or you can put them in the chat. So next we have Professor Emilia Noor Mohammed, who is a member of the Governing Council of AFREhealth and has been with this, we call it sometimes movement, for years, since the MEPI days. And she's going to tell us about capacity building in Africa using this platform. Emilia, over to you. Do you have slides, Emilia?
No, I didn't prepare any slides.
No problem. Yeah, no problem. I just wanted to know if we should pull this down. Okay. Over to you.
No. Thank you so much for this nice presentation. Indeed, I think this we was going to take the format that we did at CUGH this year, and just share how useful this platform can be for us. But before that, thank you, Andrew, for once again providing this overview of how the platform works. So in terms of my experience here in training and research capacity building, the biggest challenge that we find most of the time is really to find the appropriate mentor, the appropriate institution to partner with, and so on. When, as Elsie said, when we started this global health movement in 2010, under the MEPI program. The aim was to build research capacity in Africa, across Africa, in my case, in Mozambique, but also network amongst us. And for us, it was a moment that we were first exposed, because we are Portuguese-speaking countries. We were first exposed to this movement, and having to deal with English language. It's not easy, especially when it comes to do science. So we developed a lot of approaches, strategies to scale up training of health professionals, the beginning medical physicians and then health professionals, including creation of postgraduate training programs. At that time in Mozambique, we only have my university training health professionals. So later on, we participated in creating other public universities. Now there are we have 4 public universities, and we has the oldest university. We are supporting other public universities by providing training, teaching to undergraduate, but also postgraduate students. And also we participated in creating this postgraduate training program. But we still facing, as we create more and more training and research opportunities, we still facing lack of enough mentors and so on. And we were also exposed to these funding opportunities. So sometimes we see some funding opportunities, we see, whoa, this will be interesting, but sometimes it is required that you apply with another institutions and you don't know who is there. So by having this platform, it's really extremely useful, because you can go there and find the mentor, find the collaborator, and so on. I will stop here to not monopolize all the time. Thank you.
Thank you very much, Emilia, and the work in Mozambique has been amazing. I've watched from the beginning in 2010, 2011, how far you've moved, and it is really impressive. Thank you for sharing with us. And yeah, please make sure that you promote this in Mozambique, because it really helps to have this collaboration even across languages. It's very useful, because there's a lot we miss out from regions when we do not communicate, and everybody has something to share. So thank you so much. I don't know if Iliad has come on. Let me just check quickly, sorry. Should have done that earlier. Miliad is not on, but no worries, we'll wait for him. He may join later. And now we have the pleasure of hearing from Josephine Nabawesi, who has used this platform and is going to give us some insights in how it has helped her. Over to you, Jennifer. And please introduce yourself a little more, Jennifer.
Hello, everyone. Hello,
Hello, Jennifer, we can hear you. Yeah. Please go ahead.
Thank you all for joining in. Thanks everyone for joining in. Everyone in your respective capacity, I welcome you here. Thanks for joining in. I was tasked to talk about the perspective of the end user and the importance of networking for professional development. So CUGH capacity strengthening has a lot to offer, more so for the young people or the young people in career, because as a health worker, I'm a nurse in Uganda, For starters, I'm Josephine Nabawes, currently working at St. Francis Hospital in Zambia. I'm a nurse by profession, a proud nurse by profession. So as a health worker, I've firsthand seen the impacts that limited resources and capacity can have on our ability to provide quality care and care in other professionals, not only nursing, not only medicine, but there's a lot whereby limited access can prevent us from giving what you want to offer. So that's why CUGH, Capacity Strengthening Program or platform, is present to address this limit in resources and our training needs. So CUGH Capacity Strengthening has a holistic approach to capacity building, whereby it focuses on the following areas. Here, people are able to, just like Dr. Andrew has taken you through, whereby this platform can enable one post-training needs, different opportunities. So these, in the long run, address these gaps where we are, more so in the low and middle income countries, like Uganda, where I come from. So it addresses our training needs. It addresses the problem of mentorship. The previous speakers talked about mentorship. Mentorship is a weird relationship, if I can say, whereby it involves sharing knowledge, resources, network, and space for your mentee to take control of their careers and shine in their career. But as a mentor, it is not easy for someone to just wake up and be like, I want to be your mentor, or it's not easy for you to request someone to be your mentor and they just accept. So this platform is offering us an opportunity whereby you find people who are experienced, people who have already attained what you want as a young professional or as a young person, whereby you can connect with them, inbox them, or send them a direct message and ask for what you want or ask for their help in what you want. So this CUGH Capacity Strengthening addresses this mentorship need very much. Mentorship is if I can say, it is a one-sided relationship whereby one person badly wants something and then the other one is not having the time, the other person is just not getting you. But the way you pitch yourself out there on this platform, the way you put yourself out there on this platform can really help you address this. So community building, it helps you attain what you want to build in your community and the global network at large, because it connects people from all over the world. There are people from US, there are people from everywhere, like around the globe. It is a small village that has people who have common goals, and here we can connect and get what we want. So there's resource sharing and collaboration. Our partners, AFREhealth, we'd like to thank you so much. I know this didn't just come out of the blue. It had to take some time. So just AFREhealth and CUGH Capacity Strengthening is a bigger collaboration. So you as Josephine, you as Mary, you as where you are, you can start your collaboration through this. Just a text away, just a click away. So please, I'm calling all young people, or I'm calling everyone in your capacity to make a difference in your community and enhance your skills, knowledge, and impact in healthcare and in whatever field you are in, to join the CUGH Capacity Strengthening Program designed to uplift you. Please just sign up, take your first step in fulfilling your career, take your first step in achieving your dream, because networking is something so important. It is so important that it just doesn't look at something like professionally, even friendships, because we can be both in Uganda and we want the same thing, but then the other person is far away. But then if we meet on this platform, we can link up and get to what we want together. So please join quickly create your post, pitch yourself, because I can't know what you want unless you put it out there. So this platform gives you a chance to put yourself out there. Just describe what you want, who you are, introduce yourself, put those keywords just like Dr. Andrew has taken us through, so that you're able to connect with your mentor, with your friends, with your colleagues, with everyone across the globe, because CUGH is bringing all of us here together to address our needs. Thank you so much.
Thank you very much, Jennifer, for those comments. And yeah,
Josephine.
Sorry, I said Josephine, Jennifer. Josephine?
It's Josephine, yes, it's Josephine.
Sorry, Jess. Sorry, it's Josephine. Thank you so much for sharing with us those important comments and emphasizing the beauty of this platform. And now, since Professor Amelia W. has been unable to join, we have a bit more time for discussion, for questions. If you can, please just put up your hand and we'll allow you to speak, or you can put your question or comment in the chat. And in the meantime, Andrew has posted the link. Thank you for those that are going to use it and share it. It's already in the chat box. Okay. So, Georgina, do you have something to say?
Thank you very much, Elsie. As partners of this wonderful idea, which has been implemented and is being implemented, and we want everybody to come on board, I would like to say that AFREhealth is so committed to ensuring that everyone within its community is aware of this platform. And so this webinar is just one of the means that we are doing, and we are going to share the recordings not only to those who attended or registered, but to the entire community. And the recording will also be on the platform on our website, because that will also help people to know how to navigate the platform. And then also our regional chapters. Keith talked about the fact that it's not only meant for people in academia, research that we work with a lot, but also for governments and people in service delivery areas. And we've seen Josephine, who is coming from a service delivery area, talking about how the platform has been important to her. AFREhealth has members who are in service delivery areas. And so we are going to use our regional chapters to also propagate this within their countries, because for the regional chapters, we also have country representatives. And so we ensure that they also get this message across for people to make use of that. One of the things that as an organization, we would also need to work on is for our Francophone colleagues, because that's also very important. Because at times when you post some of these and they ask you, so how can I also navigate? Because for some of them, they cannot work with the English at all. Everything is French. So it's one of the things that together with CUGH would also have to consider, so that we can get more people from our Francophone colleagues to also be part of this. And I must say that we will continue with this at the AFREhealth Symposium in Nairobi, which is from 6th to 8th August. And so we would like people to be there so that they can also still continue to enjoy from this and learn more about this platform. So over to you, Elsie.
Thank you very much, Georgina, for those comments. I've looked in the chat, there are no questions, but please, if you want to give a comment or a question, or if you've used the platform and it has been useful, please this is the time for that. We still have some 10 minutes for discussion. And even on the panel, feel free if there's something you want to add, Keith or Andrew or Josephine, please, or Emilia. If there are no questions or comments, please, you can go ahead. Andrew, yes.
Yeah, I'll take the opportunity now to follow on with Georgina's comments just very briefly and put one of my colleagues on the spot, perhaps. Georgina, thank you so much for those really insightful comments, and I am absolutely in agreement of the one of the important aspects of this platform being the opportunity to help find ways of connecting Francophone Africa and Portuguese-speaking countries in Africa together with Anglophone-speaking countries. And so there is actually a colleague of mine who happens to be on the call today, Dr. Yusuf Njai. I don't know if you're able to voice in. You may not be in that position, but ça, c'est un appel pour les pays francophones. Si vous êtes bien positionné de un peu contribuer quelque chose to help explain a little bit more about how this platform could be of benefit to French-speaking West Africa. Dr. Njai, are you able to share with us?
Hi, Andrew. I don't know if I should talk in English or in French. But I mean, as you know, Francophone countries are always open, and Senegal hopefully to share and to work on platform that can help to improve as well, to help to know better each other and to improve our health system at the end of the day. So if you allow me, Doctor, I am right now in USAID as staff, and Chani Gay, who is at the Ministry of Health, is online. If she's still online, she can as well talk about, on the name of the Ministry of Health. Chani, je ne sais pas si vous êtes en ligne. Allô, Chani?
Oui, oui.
Voilà, donc si vous êtes en ligne, vraiment, vous pouvez également donner un point de vue du point de vue du ministère de la Santé. Merci. Thank you, Andrew. I'm looking forward.
Merci beaucoup, directeur. Bonjour à toutes et à tous. Je suis Madame Diao Tianegei. Je suis la coordonnatrice de la cellule d'économie de la santé. Donc, c'est avec un réel plaisir que je participe à ce forum et qui est très intéressant et qui va nous permettre vraiment de partager nos expériences avec les autres pays anglophones. Donc, le seul problème, c'est que toute la conférence a été tenue en anglais. Donc, nous avons quelques difficultés. Mais quand même, nous allons essayer de voir comment collaborer ensemble pour partager les différentes expériences que nous avons au Sénégal, parce que nous avons vraiment plusieurs défis à relever et il y a beaucoup de réformes que nous avons enclenchées donc, dans le pays et que nous voulons vraiment partager avec d'autres pays pour vraiment échanger et avoir aussi des orientations, des exemples de pratiques réussies et ainsi de suite. Voilà, merci beaucoup, directeur, pour l'introduction.
Oh, merci beaucoup. And that's where I end. But thank you very much. And Andrew, maybe you could just summarize what our colleague has said. Thank you very much, our colleagues from Senegal, for being here. And I hope we can work out a way of having this in French as well. Okay, over to you, Andrew.
Yeah, absolutely. So she was just expressing our gratitude for the opportunity to attend the symposium, the webinar today, and expressing the desire to advance this conversation and the need to connect and collaborate. And also mentioning the challenge of participating because the presentation today was in English. So absolutely, let's perhaps consider providing another webinar in French and Portuguese and etc. And so that would be absolutely possible to advance this conversation and further these connections. So Merci beaucoup d'avoir été avec nous aujourd'hui. Je vous apprécie beaucoup pour la considération et on espère que nous pouvons continuer de collaborer ensemble. On va bien penser d'une opportunité de faire cette webinaire encore en français. Comme ça, nous pouvons inviter beaucoup de monde qui peut être intéressé de prendre en plus. Donc, merci beaucoup vraiment pour l'opportunité et nous pouvons connecter bientôt. Merci.
Thank you very much, Andrew. Your language skills have been very useful. It's great if we can communicate in more than one or two languages. So that makes it really easy for everybody. So thank you so much, everybody, for being here. I don't know if there are any more comments or questions, or maybe we could ask Georgina to say something more about the symposium before we close, about the AFREhealth symposium. Georgina, I'm putting you on the spot.
Before I come in, I asked Josephine to do something. I don't know whether she's available to do that within 2 minutes. Then I can then come in. I think Keith also wants to come in. Keith will conclude, then I can. Josephine, I don't know whether you are available to share that.
I am available.
Just 2 minutes. Yeah.
Yes. So Georgina has requested me to share an experience of using the CUGH capacity strengthening platform. So I joined the CUGH capacity strengthening platform in 2022, I think late 2022. And with here, I was connecting with people, inboxing people, or exchanging people with whom I was seeing similar goals. I connected with Dr. Andrew himself, and I had my own desires and goals, mentorship. I made my post, and we connected, and we shared a few things here and there, and I had my visions of. By then, the platform was just, I think it was still steadily growing. And then here we shared a few ideas, and then we connected further on how we can grow this. Then here I made a suggestion of how, if we come together, different people from Africa, different people with similar goals and aspirations from Africa, if we can come up and create something whereby we can spread the word of CUGH all over Africa. So then we came up with the ambassador program, and here we connected with few African students and young professionals on the platform. And right now it's ongoing. I'm glad to report that it's ongoing, and we are going to start putting our goals we're going to show them, and it's ongoing. And I'm glad that through CUGH capacity strengthening program, I've been able to meet these fellow young people. I was able to connect with Dr. Andrew, and we've come up with something good that we are going to share in a few months, I believe. So it is really reality, and something you can do a lot more on this platform. Thank you.
Thank you, Josephine. That is beautiful to hear, and we are looking forward to hearing more about that collaboration. So,
okay. So Elsie, on the symposium, as I indicated, 6th to 8th August 2024, we are going to Nairobi to have a symposium there. AFREhealth holds annual symposium, and that allows people to share their work, what they are doing. Others will learn, and you can also network during the symposium because you get to meet other people, not only from Africa, but across Africa coming there. You can partner, and there will be funders will also be there to tell us about the funding opportunities that are available that you can apply for. You can also talk to experienced health professionals, people within research, people within health professions, education, and we are getting people from government also coming there politicians, policymakers, so would want to see you over there. The portal is opened and we've been sharing notices every week to people and within other networks because we want to see more of you there for you to learn. And every year what happens is that when people come, then people say, so AFREhealth has been there, this symposium has been, I never knew of it. Please don't wait till you get to know about it late. Join us from now and continue to enjoy with us, learning more and improving yourself, building your capacities and also impacting on others. So back to you, Elsie.
Thank you very much, Georgina, and we are looking forward to seeing everyone there. Keith, your comments?
Oh, thank you, Elsie. I was following along what Georgina said. Now, this is to the funders. So please look at AFREhealth and CUGH to support financially because of the impactful work that AFREhealth is doing. It's an incredibly important value proposition to things that funders want to do. AFREhealth's a great spot to do it, as is CUGH. And also, just to Georgina's point, it's a really important point. We are looking at, as Andrew mentioned, to not only biomedical, but it's really important to attract non-biomedical disciplines and not only engage ministries of finance, but ministries of health, engage ministries of finance, justice, public works. We all need each other to support each other in improving people's well-being and health. So that was really a plea to the folks out there. The funders need to incentivize this, and there are great opportunities to do that. Thank you again, Elsie and Georgina. And we really are honored to be here, and your partnership is really valued by us. Thank you.
Thank you very much, colleagues, all the speakers. Thank you so much for all your comments. We appreciate you taking off time to share with us about this important platform, and all people who participated. Thank you so much for being here. Thank you for I'm thanking you before. For those who have not joined yet, please join and make sure you utilize this platform. It's very useful. Networking is important to all of us. If we don't collaborate, we remain with our ideas and they don't expand and they don't go beyond ourselves. But if we share across nations, across regions, across continents, then we are able to grow together and make an impact. So thank you very much for being here. And there are more webinars that AFREhealth puts on, so please look out for them. And we are really welcoming you to the symposium in August. Please be there so that we can share. Thank you very much and have a nice day or afternoon or evening, wherever you are. Bye for now.
The speakers, please stay behind. Resource persons, please stay behind just briefly for some 2 minutes.